and coming for this series of Women's Health Wellness Program. So, Prana Yoga Therapy Center and Pranava Vibes Academy welcome you all for joining and gracing this occasion. We'll start with the prayer as our tradition. So I would request all of you to take a comfortable position. You can keep your eyes closed. Focus on the breath. Inhale, exhale, inhale. Oh. 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 Om Sahana Bhavatu Sahano Bhunaktu Sahaviryam Karvavahi Tejasvinavadhitamastu Ma Vidvishavahi. Om Shanti Shanti Shanti. Rub your palms. Cup your eyes. And gently, you may open your eyes. Thank you. Thank you once again. So today here we all have joined for the talk on infertility and yoga. So before starting, I'll just give you a data by WHO. WHO estimates that 60 to 80 million couples worldwide currently suffer from infertility. The general rate of infertility in US is 10% for reproductive couples. This is the same rate of infertility found in India, which was once known as a fertile land. So the population of the United States is 320 million approx, and the population of India is approx 1.3 billion. This would mean that there are 4 times in India compared to US. So this is really a point where we should think over. Infertility rates were found highest in women living in urban areas compared to rural areas. So now to make the awareness regarding these topics, because it is really an issue, so we have invited Dr. Garima Singh.
Good evening.
Good evening, doctor. She is a senior infertility consultant obstetrician and gynecologist, endoscopy and laparoscopic specialist. She is working at Baby Joy Fertility and CK Birla, Gurgaon. Thank you, Dr. Garima. With such a short notice and having such a busy schedule, she accepted our invite and she is with us. So not wasting much of time, doctor, I will be coming straight forward to you with all the questions, because people are looking forward to you. So, doctor, what is infertility? First, can you put some light on this?
Yeah, infertility is the failure to conceive even after unprotected physical relationship for more than 1 year. It can also be 6 months if the lady is more than 35 years. If they already know, there's already known some known cause like endometriosis, or the husband has had some azoospermia or any problem in the sperms. Usually it is 1 year of unprotected physical relationship.
Okay.
Yeah, and failure to conceive in that.
So generally in India, they always say that women are responsible if a couple is not having a child. Do you agree to this?
No, nowhere in the world. It's the child is from both the man and the women, and the causes of infertility is around 40 to 50% are because of men, and around 50% because of women, and 15% are even 10 to 15% are even unexplained infertility, in which there are no really known reasons.
Okay. Uh, I would like to know all the audience. Just you can show me your thumbs if we are going in English. So everybody is fine with English, or yeah. Okay, thank you. So you say that it is because of men
Both.
and women both.
Yeah.
So
Definitely.
what are the causes of male and in female infertility?
Well, in case of male, there are 3 to 4 main causes. There could be abnormal sperm production and functioning of the sperms, which could be because of, say, undistended testicles or some genetic disorders, or it could be because of health problems like diabetes or some infections like gonorrhea, STDs like gonorrhea, syphilis, mumps, HIV. It could even be because of certain surgical causes like varicocele or hypospadias. Then there could be delay in the delivery of the sperms. There could be blockage of the testicles or some genetic blockage or damage to the testicles, or some genetic factors like cystic fibrosis, or there could be premature or retrograde ejaculation too. Besides this, the environmental factors, as we know today, there is a lot of stress, there is a lot of tobacco and alcohol use, lack of exercise, then anxiety, marijuana use. All these factors can result in infertility in males. In addition to that, if there is some damage because of cancer, in the testicles or any other genitals, that also can result in infertility amongst males. In the females, well, the causes are manifold, more than that in the males to look at, generally, because first of all, there could be a delay in ovulation or a problem in ovulation, which could be because of PCOS, which is a big menace currently, which is a polycystic ovarian syndrome. Besides this, we could have hyperprolactinemia, hypo or hypothyroidism, the basic neuroendocrine or hormonal imbalance or disbalance can result in delayed or problematic ovulation. Besides this, there could be uterine factors, there could be fibroids, and there could be endometriosis. There could be a problem in the fallopian tubes, say blockage because of some infection like tuberculosis, which is very much endemic in a lot of states in India. Besides this, there could be some genetic factors like Turner syndrome or Fragile X syndrome, in which there is premature ovarian failure. And then there could be pelvic adhesions because of some surgeries like appendicitis or some surgeries to the abdomen. Last but not the least, obviously, there could be certain cancers which could result in, and the chemotherapy and radiation therapy of those could result in depletion of the eggs in the ovaries. Other factors that account for are the age of the women, which is very important because the first drop comes at 30 and the next at 32 years of age, the final drop at 35 years of age in the female eggs. Besides this, tobacco, alcohol, and the same stress, anxiety, all this overweight, obesity can result in infertility amongst women.
Okay, thank you. Wonderful. So doctor, you have given us so many topics, so many causes for infertility, but I would like to put you like more of we hear nowadays PCOS. That is also like worldwide growing so if you can elaborate more on PCOS.
Okay. PCOS is not just a single disease as it is usually thought to be. It is a syndrome. So it affects a lot of things, It's a syndrome it's a multi-organ syndrome usually. So it affects the ovaries. It's usually because of the hormonal disbalance, and it can result in symptoms like weight gain, abnormal menstrual cycle. There could be male symptoms like acne, hirsutism, that is hair all over the body. Then besides this, you can have, obesity. All these are symptoms of PCOS. And how do we usually diagnose them? It is usually diagnosed on ultrasound, where we have a typical appearance of the ovary with ova arranged in a necklace sort of manner. So now the basic thing about PCOS, the best thing about PCOS is that it can be treated by just lifestyle management, which is exercise and diet. And if we eat properly, eat healthy, and exercise regularly, we can definitely decrease this menace to a great extent. The main problem that it creates is infertility amongst young women, because in this what happens is that there are a lot of eggs being produced which are not of the good size, not of the proper size, and because of that there is a problem in ovulation and hence fertility. But with regular exercise and diet, we can definitely go a long way to treat this problem.
Yeah, thank you, doctor. So how do you address all these challenges when the couples come to you? Yeah. So how do you deal with them? Can you just tell us about that?
So when the couple finally comes to the infertility consultant, he has actually had a long history of waiting, of not having a baby, of visiting a lot of IVF centers. A lot of IVF failures, IUI failures are there when the patients or couples finally come to us. So these people are usually very depressed and anxious, because in India, you see, having a baby anywhere in the world is a big next step in the couple's life, and they're usually very anxious, very demoralized, very stressed. Money is a very big issue, especially with IVF centers cropping up so much, but and with the medicines being so costly in the IVF, the money definitely becomes a very big issue. That is another problem. And the success rate of IVF at the end of the day is around 45%, 35 to 45% finally, totally around the world. So this really, really makes the couple depressed. And by the time that they come to us, this is the first and the foremost problem that we have to solve to boost their confidence, to boost their energy, to de-stress them. And I feel here a lot of alternative medicine therapies, which includes definitely yoga, go a long way to help these, stressed couples, feel relaxed before we start the IVF cycles themselves. Besides this, there could be other problems like obesity. Because of stress, there is a lot of use of additives like alcohol or tobacco and all these things. These are the initial hurdles that come before and major challenges that come before we start with the treatment of the patient. So the alternative treatments can go a long way in treating them.
Okay. Thank you, doctor. There is just a request from the audience that if you can say few lines in Hindi also, because some audience are with a Hindi background, so they would like to hear in Hindi also.
बिल्कुल हिंदी में बोलने की हम चेष्टा करें.
Thank you. So before starting with the topic of IVF, here I would I would like to tell you all that Robert Edward was awarded the Nobel Prize in 2010 for the development of human in vitro fertilization, that is IVF therapy. His work began in the 1950s, culminating the first child born in 1978. Our born year of doctors and mine, and the first child was born at the same day of doctor's birthday. So that is interesting fact. And as a result of IVF with clinical management by a gynecologist, Patrick Christopher, globally, approximately nowadays, like 5 million children have been born as a result of IVF. And this is really an innovation defined as a milestone in modern medicine. So this is really a great job done by Robert Edward. And now with this, I would like Dr. Garima, if you can elaborate more and tell us what actually is IVF, if you can explain IVF.
तो मैं इसमें पहले ये बताना चाहूंगी कि आईवीएफ में जब मेरे पास मरीज आता है, जब मेरे पास पेशेंट आता है, तो वो आगे ही एक लंबी रेस दौड़ चुका होता है, जिसमें एक नॉर्मल ट्रीटमेंट जो वो पहले लेता है डॉक्टर से, जिसमें हम आईयूआई करने की कोशिश करते हैं, जिसमें हम उसका इलाज करके उसकी हार्मोन्स नॉर्मल करने की कोशिश करते हैं. अगर इन सब चीजों के बावजूद से उसने 2-3 बार आईयूआई करा लिया है, उसका 3-4 बार इनफैक्ट हो चुका है, और उसका हार्मोन का ट्रीटमेंट हो चुका है, उसकी सारी जांचें हो चुकी हैं, कि कुछ ना मिलने के बाद और कुछ प्रॉब्लम पता लगने के बाद दोनों केसेस में हम लोग, जैसे मैंने आपको बोला अनएक्सप्लेन इनफर्टिलिटी भी होती है, इन दोनों केसेस में हम लोगों को फाइनली आफ्टर दिस वी हैव टू गो फॉर आईवीएफ। आईवीएफ में क्या होता है कि हम एक महिला के बहुत सारे जो अंडे होते हैं उनको हम स्टिमुलेट करते हैं ओवरीज में इंजेक्शंस लगा के, जिससे बहुत सारे एक ही बार में हम निकाल लेते हैं, जिनके बाद उनके पति के शुक्राणुओं को साफ करके उनके साथ मिलाया जाता है और भ्रूण बनाए जाते हैं शरीर के बाहर। ये भ्रूण फिर बाद में महिला की अच्छी सी लाइन बना के, जो लाइन बन रही होती है उसकी अच्छी सी लाइनिंग बना के, एंडोमेट्रियल लाइनिंग बना के वो भ्रूण उसके अंदर रख दिया जाता है। इस पूरे प्रकरण को आईवीएफ कहते हैं। और ये आईवीएफ जो है एकदम नहीं होता, ये फर्स्ट स्टेप नहीं होता। जैसे मैंने आपको पहले मैं बताने की कोशिश कर रही थी, क्योंकि कभी भी आईवीएफ कोई किसी भी ट्रीटमेंट का फर्स्ट स्टेप नहीं है, ये फाइनल स्टेप है कि जब हम सब चीजें करके हार गए तो फिर आईवीएफ की ओर जाते हैं। और ये मेथड है। और आईवीएफ में और इसके आगे भी बहुत मेथड्स होते हैं। जैसे किसी के पास अंडे नहीं है तो फिर डोनर्स का प्रयोग होता है, या स्पर्म्स शुक्राणु नहीं है तो भी डोनर्स, तो मेल डोनर्स लिए जाते हैं। या फिर जिनके पास आजकल तो जिनके पास नहीं है, बिल्कुल ही नहीं अपने अपने आप से शुक्राणु का प्रोडक्शन होता, तो वहां पे टीजा पिज्जा बहुत सारे अलग मेथड्स हैं जिससे हम शुक्राणु निकाल सकते हैं। या फिर ये जरूर है कि एक बार महिला की एक एज क्रॉस हो जाती है और उसका एएमएच कम हो जाता है, अंडे कम हो जाते हैं, तो उसके बाद अंडे नए प्रोड्यूस नहीं किए जा सकते। लेकिन ये है कि उसमें फिर डोनर्स का सहारा लिया जाता है। तो आईवीएफ इस ढंग से किया जाता है यूजुअली।
ओके ओके, बहुत बहुत शुक्रिया, अच्छे से आपने एक्सप्लेन किया। एंड तो आपने अभी बताया कि आईवीएफ इज लाइक लास्ट दिस थिंग आफ्टर कमिंग ऑफ ऑल
Yes,
दीज थिंग्स,
yes,
एंड देन आल्सो वी हियर अबाउट आईवीएफ फेलियर.
yes.
So after spending so much of money,
Yeah,
and then there are IVF failure, as you said that only 45% is the success rate.
yeah.
So what are the causes of IVF failure?
देखिए, एक बहुत बड़े कॉजेज ये रहते हैं कि एक तो स्ट्रेस में पहले ही बहुत ज्यादा पेशेंट होता है, जैसे मैंने पहले भी आपको बताया, स्ट्रेस में होता है, पैसे का खर्चा है और सब चीजें हैं। लेकिन फेलियर की और रीजन ये भी होते हैं कि ब्लड सप्लाई कई बार यूट्राइन लाइनिंग में उतनी अच्छी नहीं हो पाती। बहुत बार बच्चा जुड़ जाता है पर पूरी तरह से एंड तक नहीं प्रोड्यूस होता, पूरी तरह से लास्ट तक प्रेगनेंसी नहीं कंटिन्यू होती, क्योंकि लाइनिंग ठीक नहीं है, ब्लड सप्लाई पेल्विक ऑर्गन्स को ठीक नहीं है। या फिर ये हो जाता है कि जो है वो चिपकता ही नहीं है, जो भ्रूण हम बनाते हैं ए ग्रेड का भी बनता है, या फिर कभी कभी भ्रूण ही नहीं अच्छा ग्रेड का बनता। तो बहुत सारे अलग अलग कारण हैं जिसके कारण आईवीएफ फेल होता है, क्योंकि आईवीएफ नेचुरल प्रोसेस नहीं है, ये कृत्रिम आर्टिफिशियल प्रोसेस है जो हम कर रहे हैं। तो ऐसे भी जब पति पत्नी दंपति दोनों साथ रहते हैं एक दूसरे के साथ, तो हर एक साइकिल में तो प्रेगनेंसी नहीं हो जाती। हर साइकिल में ओनली 20 से 25% चांस होते हैं प्रेगनेंसी के, अगर आप सब चीजें ठीक हो तो भी। तो आईवीएफ में डिस्पाइट सब चीजें ठीक होने के कुछ ना कुछ कभी कभी गड़बड़, कई बार जेनेटिक डिसऑर्डर्स होते हैं दोनों में से किसी में कि अच्छा भ्रूण ही नहीं बनता। तो बहुत सारे अलग अलग कारण हैं जिसके कारण आईवीएफ फेल होते हैं, क्योंकि आईवीएफ एट द एंड ऑफ द डे इट्स एन आर्टिफिशियल प्रोसेस। तो बट if it is done 2 or 3 times, that is why we give a chance of 2 to 3 times, because हर टाइम अगर 40% हो जाते तो फाइनली आप कंसीव कर ही लेते हैं। बस ये है कि थोड़ा पेशेंस, थोड़ा सब्र, थोड़ी सहनशीलता बहुत दरकार है आईवीएफ कराने में।
Okay. How do you take patients, like what you advise to patients? I will not go more in medicines, but other than medicines, what you will suggest to your patients, or you suggest to increase the number and like the quality of the sperm and egg, or like improving the, as you said that this IVF का जो rate है उसको हम लोग बढ़ाने के लिए, या तो फिर हम ऐसा कह सकते हैं कि blood circulation, if it is better in pelvic area,
Yeah.
so the chances can be more. So how you take this ahead?
Okay, so ऐसा है कि दवाई छोड़ के हम there's a study in the Harvard University a few years ago. There has been a study that if one does artificial, not artificial, if one does yoga with IVF, in fact, other exercises and regular diet and exercise, proper diet and exercise, especially yoga, then the chances of reproduction increases by 30%, 3 times, increases 3 times in case of IVF treatment. So this shows that if we do these alternative methods, especially yoga, हम बहुत सारे पेशेंट्स जो हमारे पास आते हैं, हम उनको ये एडवाइस करते हैं. ये सिर्फ इसलिए मैं नहीं कह रही हूँ कि मैं योगा के सेशन में बैठी हूँ या योग का प्रचार करने के लिए बैठी हूँ, पर वाकई बहुत सारी ऐसी प्रॉब्लम्स हैं आईवीएफ के पेशेंट्स में जो योगा से बहुत ठीक हो जाती हैं. जैसे एक छोटा सा एग्जांपल आपको दें कि हमारे पास जब आदमी आते हैं कि शुक्राणु कम है या शुक्राणु काम नहीं कर रहे, तो उनके लिए एक आसन हम बहुत सजेस्ट करते हैं जिसको कहते हैं मूल बंद आसन. इसके अलावा पीसीओएस के लिए बहुत सारे आसन जैसे मार्जरी, बितिला, सर्वांग, देन यू हैव ये वीरभद्रासन, बहुत सारे आसन ऐसे हैं, और चक्की पीसना जो आपके एब्डोमेन, पेट के फैट को रिड्यूस करते हैं और आपकी ब्लड सप्लाई पेल्विक रीजन में इंक्रीज करते हैं. इसके अलावा ऐसा जो है, जो थायराइड जिनको प्रॉब्लम होती है, हम ही उनको सजेस्ट करते हैं कि सर्वांग आसन जो शोल्डर स्टैंड्स होते हैं वो करें ताकि थायराइड में ब्लड सप्लाई इंक्रीज हो. तो बहुत सारे ऐसे एक्सरसाइजेज हैं, स्पेशली हमारी अपनी ये योगा जो है वो बिल्कुल भारतीय मूल की एक्सरसाइज है और व्यायाम है उसका. और अगर हम ये करें तो बहुत सारे, मतलब हम बाहर जाके इलाज ढूंढते हैं और बाहर जाके ट्रीटमेंट ढूंढते हैं और बाहर वाले हमारे में सारी चीजों के उत्तर ढूंढ रहे हैं, तो हम सबसे प्रकृति के निकट हैं जब हम ये सब करते हैं. और ये सब करने से ना केवल हमारे हार्मोनल प्रॉब्लम्स, हमारे मेंटल इश्यूज, हमारा जो न्यूरो एंडोक्राइन एक्सेस है जिसको हार्मोनल एक्सेस कहते हैं, एंजाइटी रिलीज होती है, एंजाइटी खत्म हो जाती है. और इन सब चीजों को करने से अगर हम 6 हफ्ते प्रॉपरली ये सब करें तो बहुत बहुत फर्क पड़ता है फाइनल रिजल्ट ऑफ आईवीएफ में. ये आप बहुत हैरान होंगे जान के.
रियली और ये आज तक मुझे नहीं समझ में आता है कि इंडियंस को हमेशा ये हमेशा ही होता है कि वेस्टर्न से हम लोग इतने ज्यादा अट्रैक्ट होते हैं, और जब घूम फिर करके योगा वेस्टर्न से आया तो हम उसको एक्सेप्ट कर रहे हैं. लेकिन कि जब अगर यहाँ पर ही योगा, जैसा आपने बताया कि यहीं का है, मूल है, हमारी खुद की धरती का है, तो और आपको जानकर के खुशी होगी कि हमारे बीच में डॉक्टर प्रीति शर्मा हैं, जो कि एक आयुर्वेदा डॉक्टर हैं एंड योगा एक्सपर्ट, योगा थेरेपिस्ट, एंड शी हैड वर्कड इन दिस फील्ड for last 25 years. So she is having 25 to 30 years experience in this field. So I would like to hear something from you also, ma'am. If you can also put little light on this topic, as we are talking about infertility and how yoga helps. So if you can just enlighten us with your knowledge.
Good evening.
Good evening, ma'am. Good evening.
Good evening, Dr. Garima.
Good evening, Dr. Preeti. Good evening.
Good evening, audience, everyone in the group. And yeah, Geeta ji, thank you for inviting me as well. So I totally agree, Dr. Garima, आपके साथ में आप जो कह रही थी मैं पूरी तरह उससे सहमत हूँ. एंड ये बातें हमने भी देखी है कि आईवीएफ तक पहुँचने के बाद भी यदि आप योग का सहारा लेते हो तो काफी हद तक हमें सफलता अच्छी तरह मिलती है. So the rate of success is increasing. I know, like yoga puts things like, like things start falling into place. So as Geeta ji was also saying that about the energy circulation. So yoga mein we call it as the energy flow throughout the body. These channels are there, which would actually, allow this energy to flow uniformly in all the areas. And there are certain voids happening. So according to the yogic chemistry or yogic physiology, they would say that कुछ शरीर में ऐसे हिस्से हैं जहाँ पर एनर्जी या ऊर्जा, प्राण शक्ति पहुंच नहीं पाती है, उसकी वजह से पोषण की कमी हो जाती है. और हमारा वो लाइफस्टाइल उसके लिए बहुत जिम्मेदार है, जो आपने कहा था, वो भी आयुर्वेद और योग दोनों इससे सहमत है. तो जब आप लाइफस्टाइल सुधारते हो, आपका फूड हैबिट सुधारते हो और आपका योग प्रैक्टिस करते हो, यानी आपका जो आहार विहार हम इसमें कहते हैं कि वो आप सही ढंग से चलाते हो, तो आपको तकलीफें कम आती है. और हो सकता है आईवीएफ तक पहुंचने की इतनी नौबत भी न आए. कई बार ये पीसीओएस के केसेस हमने आयुर्वेद और योग के कॉन्सेप्ट्स को फॉलो करते हुए हमने काफ़ी अच्छी तरह से हैंडल किए थे. और हमारे पास कई ऐसे एग्जाम्पल्स है जो लेडीज ने कंसीव किया इन स्पाइट ऑफ हैविंग पीसीओएस इन द पास्ट. and they are having happy, healthy babies now. IVF के cases में भी हमने ये पाया था कि couple is going through IVF, but then they start with yoga, and of course the rate of success was there. I mean, they had 1 or 2 failures, and then they started with yoga, and then कुछ समय दिया, उनके डॉक्टर ने उनको सजेस्ट किया कि आप योग कीजिए, और उन्होंने जो सेशंस शुरू किए 2 महीना 3 महीना इसको दिया डिटॉक्स करने के लिए, and they followed the proper lifestyle with food habits and sleep patterns and exercise, yoga. So all that helped, and the third IVF became successful. So ऐसा भी हमने देखा. तो आप जो कह रहे थे कि फूड हैबिट्स एंड लाइफस्टाइल, ये सब कुछ जो चेंज हुआ है, जैसे गीता जी ने कहा कि अर्बन लाइफ में जो चेंजेस हैं उसकी वजह से विमेन में अर्बन एरिया में ज्यादा हम इनफर्टिलिटी के केसेस देखते हैं. So that is also true. Like I will just tell you like the concept in Ayurveda, where in Ayurveda the first part recommends about the maintenance of good health. Geeta ji, what is that sound coming?
I'll just, I've muted. Yeah.
So that Ayurveda recommends how to maintain good health. That is the first part. So with that, they tell you that ahar, nidra, and brahmacharya. So ahar is the food habits, sleep patterns, nidra, and the brahmacharya is your proper activities. It's not about only celibacy, but yes, the proper activities, your senses, using your senses properly, using your body properly, the physical activities, mental activities, all that matters, and you can have a good, healthy life. Then there is a concept of dhatus in Ayurveda, like there are 7 dhatus, rasa, rakta, mans, med, asti, majja, and shukra. And shukra is said to be the last dhatu, the end product. And these dhatus are formed in the sequential form. तो आपका फूड हैबिट्स, फूड पहले अच्छा होगा तो फर्स्ट धातु आपका रस अच्छा बनेगा, फिर उसके बाद वो रक्त की तरफ जाएगा और रक्त को भी अच्छा बनाएगा. So one after the other, the dhatus are being formed, and the last dhatu is the shukra, which is with the reproductive system, which is the egg in the women and the sperm in the men. So that way they will give you good quality of sperm and eggs, that is the shukra dhatu. And for that also they have proper lifestyle patterns, that you have to have a proper food habit, timely eating, good quality of food, quantity, time, the देशकाल, ऐसे सब छोटी छोटी बातें उन्होंने बताई गई है कि आपका क्लाइमेट, आपका एरिया, उसके अनुसार आपको खाना पीना है, आपका फूड हैबिट्स इस प्रकार चेंज करना है. आजकल जो हुआ है कि जो प्रोसेस्ड फूड्स आए हैं, जो फूड की क्वालिटी या रॉ मटेरियल है, उसमें भी काफी सारा पोल्यूशन आ गया है. सो व्हाट वी आर ईटिंग and how much nutrition we are getting, so that nutrition is also important in this aspect to give you that proper quality of shukra dhatu, to give you proper quality of sperm and egg. And then your sleep patterns. तो आजकल ये जो हुआ है, तो the hormonal cycles जो आप लोगों ने बात की, तो hormonal cycles में भी disturbance आता है, as you all know, thyroid hormones, diabetes, all these are associated and they can be a factor to bring in infertility. So your yoga practices also bring back the hormonal cycles to their normal schedule. So this all together has helped in bringing in happiness among couples when they are going through different phases of infertility. And when we always talk about yoga with such couples, we never call it as infertility yoga, we call it as the fertility yoga. So to start with the positivity in the name itself. So we have got very good experiences with Ayurveda herbs as well, which are very important and very good. So good Ayurveda practitioners have been using some herbs and some different processes like basti treatments and all, which have helped couples, which have helped women also to handle with different issues of PCOS. Like as you mentioned about endometriosis and this PCOS and this different other factors like prolactin, where the prolactin levels are disturbed. So these things have been handled with Ayurveda and yoga very nicely, because Ayurveda and yoga have been like sister sciences. And the asanas, what you mentioned, Dr. Garima, also are very true. Addition to that, there are many more asanas. So very well said about Sarvangasana, as you said, it really works. So I'll tell you about this small thing. As you mentioned about Sarvangasana, the theory in yoga goes that way, that there is this prana and apana. Prana is that energy which you breathe in, which you bring in. And apana is something which is given out, so that is a toxic, which helps. The apana is the energy which helps to bring out toxins. Okay, so whatever is not needed from the body is being expelled. Either it can be exhalation or any other thing which is excreted from the body is because of apana. So now apana and prana, they have their own directions. So prana is supposed to go upwards and apana is supposed to go downwards. And that way, when this direction changes or they get blocked somewhere, that time also yoga helps. So yoga helps them to take their proper direction. Now, to make this prana reach the pelvic area, you can do topsy-turvy poses. You can do those inversions. And wherein Sarvangasana again plays a very great role. Even Viprit Karni plays a great role. Shirshasana plays a good role with men as well. So this type of things, and of course combined, I'm not talking about only one asana, but this was just a concept to be explained with this asana, with the concept of the asana. And there are many different asanas, like as you said, Paschimottan and this Ustrasana, and all those do work with the ovarian the cycles. They work with the uterine linings. They work with there's a collection of matter around the ovaries, as you said, like you get chocolate cysts and this polycystic ovaries. So these are also being held. So that is also a vast science where we connect Ayurveda and yoga together. Because in Ayurveda, when they say about some Vata, Pitta and Kapha, and PCOS can be related as the disease arising from Kapha. Kapha का जो different क्या बोलते हैं उसका मतलब विकार हो जाता है. We call it विकृत kapha. The kapha which is not normal, which is giving rise to different problems, and PCOS is one of them. And when you read the yoga text, so that is why when you go into the tradition, the traditional text of yoga like Hatha Yoga Pradipika, Gheranda Samhita and all those, when they say some practices which are bringing back the kapha dosh into normalcy, you have to look into that. You have to look into that and you can think deep over it and how this is going to help with PCOS. Also, you mentioned about this Mool Bandha, and we entertained the Kegel exercise and Mool Bandha. There are 3 bandhas, and of course, Mool Bandha is one type where also this Kegel exercise also can be used. So of course, जो योग के जानकार है वो जानते हैं कि मूल बंध कुछ डिफरेंट है और अश्विनी मुद्रा नाम का भी एक प्रकार है. So ये दोनों आप यूज कर सकते हो, which helps in the lower abdominal energy circulation. So all those, I mean, in a nutshell, I could just tell you this. And I have found very good experiences. I have got live examples. Unfortunately, those teachers could not join us. We had yoga teachers with us working at our center. And I would just mention, not mentioning her name, she could not join today, but she was going through IVF. She did IUI and everything, and it was a complete failure. She ultimately gave up that. And now, I would just live my life that way. And the couple was, they had just lost hope completely. And she was just focusing on her activities and yoga and everything. And after 2 years of giving up completely, she ultimately, one day, she just realizes that she's missed her period. She went and checked and she was pregnancy positive. And it was such a great happiness. She had naturally conceived. So as you said about the unexplained infertility, might be that. So, yeah, and now her daughter is more than an year. And
Oh,
it was a great pleasure. Yeah. And at the age of 42.
wow. Yeah. Yeah.
So that was our experience.
Yeah.
Great to hear from you, Dr. Preeti. And at such times when the couples are like so depressed and stressed, as Dr. Garima also mentioned, that the couple is because it comes on the pocket also. So at this time, as we know, stress is mother of all. So at this time also, this yoga helps. And the anxiety, the depression, all these things, because they go through a lot. So in these phases, actually, they require, and this yoga gives them the peace and the calmness and the quietness of the mind and all these things. So I think that, and as ma'am said, that these two siblings, the two pathies, really work very well if they are like together. So I'll just now, Dr. Garima, if you would like to add something on this.
No, I just heard about it was a beautiful talk by Dr. Preeti, and I really felt whatever we are doing at our centers with, we were in fact even contemplating of starting yoga in our centers soon in Baby Joy itself, because we felt that it was really helping a lot of our patients, and we wanted them to, start with yoga 6 weeks beforehand, along with the treatment that we give. All these asanas have been really helpful and productive in bringing about better results. Definitely. And before anything else, we could ourselves also start doing them at home, and they're comfortably since they're not very exertive or not very cumbersome or difficult. We can definitely do them. One thing I forgot before was that all these breathing exercises, which includes the pranayams and the Brahmari pranayam, then you have a lot of Kapal Bharti. All these have really help in reducing in bettering the ovarian health and the health of the uterus both. In fact, I have seen people improving considerably with their endometrial lining, especially after doing these breathing exercises itself. So I would like Dr. Preeti to give some insight into this also, because this I have seen to be very helpful to a lot of patients.
Yes,
Dr.
Brahmari
Garima.
pranayam, as you mentioned, is a very beautiful. So, ma'am, if you can just enlighten us through this pranayams also.
Yeah. So, can you hear me?
Yes, ma'am.
Yeah, thank you. So pranayams have also, even I missed out on that point, but pranayams do help in good microcirculation, because they help to, balance your hormones. Like, as you say, that the pineal gland and the pituitary gland, they are the master glands in the body, and they are like they are having all the remote control. So that is much affected when you do your pranayams regularly with proper dedication and proper timing. Okay, I have seen many places where pranayams are not given much time. So you need to give at least 20 to 25 minutes for the pranayamic practice. And the result of the pranayam, I mean, it should be a combination, first of all, as you said, Kapalbhati, then the Anulom Vilom. Because Anulom Vilom is a wonderful practice to balance the sympathetic and parasympathetic nervous system. As you said, also the neuroendocrine factor, that this thing gets balanced with the Anulom Vilom. And it's a wonderful pranayam. Then your Brahmari, your Shitali. Shitali is a wonderful pranayam to bring down the heat, because with all this, maybe medication, maybe stress, maybe all other lifestyle changes, there is a lot of heat in the body. And in through Ayurveda and this thing, we call it like Ushnata or Pitta, which is like, like an acid. So your Shitali pranayam is a wonderful pranayam to cool down your system. And the gut is the mother system, according to Ayurveda. So your gut should be healthy. Your digestive tract, your gastrointestinal tract is the system through which all other systems are getting their nutrition, their nourishment, their, how they get replenished. So your gastrointestinal tract should be very healthy. So your food, of course, plays a great role, your sleep pattern, as I said, and then the Shitali pranayam also works wonders with this. Your Brahmari pranayam is working very well with the nervous system, bringing down stress levels, bringing down the blood pressure if it is high, or otherwise keeps it in balanced state. So all the pranayams together would work on the microcirculation. And if your hormones like your estrogen, progesterone, your FSH, LH, all those things who are responsible to build up the endometrial lining, if they are functioning properly, they are being released in proper quantity, in proper time, then the lady is supposed to have a good endometrial lining as well. And as you said that you have seen these results, that is why the pranayams work with the endometrial lining.
Yes.
And yes, meditation as well. Okay, so some relaxation techniques, meditation, that should also be included in the program. So it should be always a combination of your asanas, your pranayams, your meditation, and that's understanding where this energy needs to be directed, what is happening in the body, why this is all happening. So that, as you said, that you talk to the patients and you become counselors as well. So that counseling part is also very, very essential.
Very important. Thank you.
Yeah, so as we saw, this is a holistic approach, we can say, all put together, and then we can have nice results. So with this, it was
but
a really very...
Geeta ji, to add to this, I would also mention that once the couple conceives, let this yoga be a part of their life, at least till the baby is born. Yeah. So that is the reason we have this training about pregnancy yoga also. So we have our sessions where we give sessions to pregnant ladies. We train yoga trainers who are already certified yoga trainers, but that is still not confident with pregnancy yoga. We train them in this aspect of pregnancy yoga, covering everything, like, anatomy, physiology, the modern aspect, and the yoga aspect, and how do you modify these practices according to the needs of the pregnant lady. And we have got very, very beautiful results with pregnant ladies, and they do the yoga part very beautifully. Very beautifully. They perform the yoga practices, and we do a variety of practices. So with the pregnancy, nothing is restricted. Even we make them do sun salutations, which are modified to their needs.
Okay.
So that is a very wonderful experience which we had. I mean, we have had people, ladies who have been doing yoga before pregnancy to make their body fit. I immediately remember one example of a lady who came to us with one case where she had diabetes, and because of diabetes, she lost her baby. I mean, first pregnancy, she had full 9 months, she delivered, and after that, she lost the baby. And she was under severe depression. And then again, she was wanting to conceive. Her gynec had advised her to do yoga, and her hormones were really disturbed. The prolactin levels were very badly affected, and all those things had happened. So we started with yoga. We did yoga regularly for 3 months, and then it was a nice thing that she conceived. She did yoga for the whole 9 months. So it was like 1 full year we were together, and she has 2 children now at present. So that was also a very good example for us. So that's how this the hormones also got affected, and that's a live example, that the hormones get affected and they come and fall into place, and they get good results.
Thank you, Dr. Preeti, and thank you, Dr. Garima Singh. It was really a wonderful session, and I think now we can open the session for Q&A, so that if there are any queries or any questions, then our participants and audience can ask with permission of both the doctors.
Definitely.
Yeah, sure.
So here we are. So if any of you want to ask anything, both the doctors are here. You can ask them anything regarding the infertility or yoga or regarding the classes and everything. any one of you would like to give us the feedback? How was the session, or what you all? Yeah, Veena ji, please.
Good evening, doctor. Good evening, Dr.
Good
Preeti.
evening. Good evening.
Good
I would
evening.
like to ask, because we are also giving the prenatal training online sections, and many times it has been told after IVF, they are not allowed to, no, after giving during the treatment, why they are not allowed to practice yoga. That's what we hear from the from our clients.
No, no, it is not that way. Once the transfer has been done, it takes 6 days for the embryo to attach to the uterine lining properly. And then the blood supply has to be increased. We never insist on stopping yoga, but we definitely say that we do the gentler, more restorative forms of yoga, which include the hatha or the lighter forms of yoga, not the harder forms like we cannot use the Bikram or Ashtanga. That kind of yoga we stop, but we definitely ask them to follow the gentler forms of yoga. That is no problem.
Traditional yoga, you mean?
Yeah. We just
not the modified ones.
not the modified ones. We ask them to do the lighter versions so that the blood supply to the uterus does increase and the embryo, which has already attached, feels more comfortable in the better lining and better nutrition. It gets better nutrition once the blood supply increases. So we definitely do suggest them to do yoga, which is the lighter, gentler, which with consciousness of both mind and body, because mind meditation is very essential during this time, in addition to your the yoga for increased blood supply. Both
Many
of the
them, when they are undergone preconception, then when they conceive, maybe especially through IVF, they don't turn up only for 3 months. So I was really puzzled. So just
no, we do suggest that gentler forms of yoga can be done. It is not an issue, but just once we need to see that it becomes positive, then we're very, very confident and very happy to suggest them to go in for all the yogas, barring those which are the harder ones, the modified ones, as Dr. Preeti said. Yeah.
Thank you, doctor. Thank you, doctor.
Sure.
So here I would like to just mention that we have also seen that uteroplacental, that circulation, also improves. Some ladies who had this lesser, when there was a resistance, the resistance was lesser after doing yoga, and the uteroplacental circulation was much more free. So as you said, the circulation also improves. And of course, we do look into the sonography, the medical reports, everything before we start with the yoga. And we teach this to our yoga trainers also, whoever are learning with us.
Yeah, definitely. Because the blood pressure would be, with relaxation, the blood pressure would decrease, and that would help the placental circulation, the uteroplacental circulation, as you said, to improve. The stress would be released and everything would be better if we do those kinds of yoga.
True.
Yeah.
Thank you, Veena ji. Any other participant would like? Yeah, Kabita ji, you want to say something?
Yeah. Yes,
please.
Very nice session actually. Just wanted to ask कि अश्विनी मुद्रा लास्ट तक कर सकते हैं क्या at the time of pregnancy?
Yes, कर सकते हैं आराम से.
Yeah, one of gynecologists actually told me that before 2 months of delivery कि आपको अश्विनी मुद्रा नहीं देना है, Kegels also. So that's why I'm asking.
और अश्विनी मुद्रा की खूबी क्या है कि आप उसको अलग अलग पोजीशंस में कर सकते हो. आप उसको मार्जनासन की पोजीशन में भी कर सकते हो, आप उसको पवनमुक्तासन की पोजीशन में कर सकते हो, सर्वांगासन की पोजीशन लेके वॉल के सपोर्ट से आप कर सकते हो. ओके. और मॉडिफाइड सेतुबंधासन है, जो सेतुबंध सर्वांगासन है विद सपोर्ट, या तो आप बेड या काउच का सपोर्ट लेके वो भी आप कर सकते हो. तड़ागी मुद्रा की पोजीशन में आप अश्विनी मुद्रा कर सकते हो. ओके. एंड जस्ट सिंपल सिटिंग क्रॉस लेग्ड ऑन अ कुशन, आप मतलब सॉफ्ट सरफेस अपने पेरिनियम के नीचे हो, ऐसा पोजीशन में भी आप अश्विनी मुद्रा कर सकते हो. So no problem at all. Or I am having right now, I am having some clients who are in the 9th month. At least 2 clients are there in the 9th month, and they are still doing this Ashwini Mudra and this.
Earlier I used to actually something like pregnancy leti because I'm also did that specialized pregnancy course. But somehow just 6 months before, one of the gynecologists say advised me. That's why I'm asking.
नहीं, मुझे तो कोई कॉम्प्लिकेशन कभी नहीं मिला. इनफैक्ट द हेल्थ ऑफ द बर्थ कैनाल, यू नो, vaginal health also remains better when you're practicing Ashwini Mudra and this Kegel exercise.
But Kegels के करने के बाद also sometimes after delivery 7-8 months हो जाता है, then also urine control नहीं होता, some issues रहते हैं after delivery. So what they have to do exactly?
यूरिन इनकॉन्टिनेंस की बात कर रहे हो ना?
Yes, yes.
हाँ, तो यूरिन इनकॉन्टिनेंस काफी कॉमन प्रॉब्लम है, जिसके लिए भी हम लोग टमी टक्स और डिफरेंट एक्सरसाइजेस देते हैं, जो कि पेरिनियल एरिया के मसल्स को टाइटन करता है. एंड इट हैज गुड रिजल्ट. या
I have seen some patients जिनमें actually इसको autonomous bladder बोलते हैं, हो जाता है.
Yes.
What happens is that just urine is passed without there is any information. जैसे अपना urgency, he just passes it. And this has nothing to do with this is something to do with the nerves and the spinal cord. जब autonomous bladder होता है, which is very rare, but it does happen. But हाँ, yoga per se for the normal other people जिनको ये rarity is just for 0.1%. Otherwise, it does help. The Kegel exercises definitely help in reducing, the postnatal urine incontinence problem.
Yeah. Okay. But after practicing that Moola Bandha, Ashwini Mudra, and also Kegels, so but somehow I don't know, उसको still that problem.
वो autonomous bladder वाला हो गया. 1 or 2% patients are like that, but which is quite rare. It does happen.
Very true. ये हो सकता है, बहुत कम होता है चांस, राइट?
बहुत कम. I have seen just in my practice of say 20 years, I've just seen around 2 patients have this, but they did have autonomous bladders, and it was so difficult for them. We have to really treat them after catheterization and proper different process.
Thank you very much.
Of course, we have to also reduce the weight around the belly, to lessen the pressure on the bladder.
Yes, yes.
Then your Kegel exercise works better.
Very true, said by doctor. So anybody else would like to ask anything? Any other questions are there? So I think
my question is age matters, or till what age anyone can try to conceive?
Yes, definitely. Age in a woman, age matters a lot. When a girl child is born, she comes with X numbers of eggs. Usually it is said 7 million odd some. And when she starts with puberty, only 20,000 women. And those eggs, they continue till all through her menopause. So with age, not just the number of eggs, the quality of eggs also deteriorates. Because since you were born, you're with X number of eggs, and those are the eggs that are getting older with age. The first drop comes somewhere around 30, which is very little. Next is 32 years. 32 years is the major drop that we say, the first major drop. The next major drop is at 35 years. Conception can even occur to a lady who is 42 or 43 or even 45. But that's a rare chance. That's that is a kind of chance that sometimes one of the egg, which is good in quality, ruptures, and you're staying with your husband, and somehow you conceive. But if you ask for the natural conception, which is easier, it should be usually around by around 34, 35, you should decide to finally complete your family. Because first, as I told you, first drop comes, the bigger drop comes at 32 years of age. And then after that, obviously the quality of the eggs also deteriorates. If 40 you conceive or 45 you conceive, there are more chances of the baby being formed with congenital malformation, some genetic abnormalities, because the egg quality has deteriorated. It is an older egg, you see.
That's very
so always it is said that जैसे कि पहले के लोग कहते थे कि पर्टिकुलर एज जो होती है वो मैटर करती है, तो जो एक हेल्दी बेबी के लिए कौन सा, मतलब नॉर्मली ऑब्वियसली एक मेजर एज ही होती है, बट एक पर्टिकुलर कौन सी एज एडवाइजेबल होती है कि हाँ दिस टाइम तक?
देखिए 30 साल की उम्र तक सबसे अच्छा रहता है कि आप कंसीव कर लीजिए. आजकल क्या है, हम क्योंकि 30 साल हम बढ़ा के कह रहे हैं, क्योंकि आजकल सारी महिलाएं, देयर आर लॉट ऑफ वुमेन हु वर्किंग कामकाजी महिलाएं हैं, तो आप उनको ये नहीं कह सकते पढ़ती हैं, काम काज करती हैं, जब तक आप उनका काम भी हो जाए और उनका ये प्रॉपर भी रहे, तो 30 साल तक की उम्र में तक उनको कोशिश करना चाहिए कि अपना फैमिली जो है वो स्टार्ट कर दें और कंप्लीशन कर दें जल्द से जल्द, 30 years. Before that it is very 24 to 30 it's very good, but उतना, क्योंकि आजकल इतना कंपटीशन है वर्क प्लेस में भी, हर चीज में, सो इसको थोड़ा इंक्रीज करके हमने इतना कर दिया। नहीं तो यूजुअली तो अच्छी एज तो 24-25 साल ही है एज यूजुअल, उसमें जल्दी इजी कंसेप्शन हो जाता है।
आजकल तो शादियां 30 के बाद हो रही हैं बहुत सारों की।
इसलिए तो आजकल कह रहे हैं कि आप पहले एग फ्रीज कर लीजिए ना, निकाल के फ्रीजिंग करा लीजिए ओवम की, ताकि बाद में परेशानी ना हो, फिर आप आराम से कीजिए 40 तक। बच्चा पालना, पैदा करना आसान होगा, पालना मुश्किल हो जाता है फिर।
बिल्कुल। अब मेरा नेक्स्ट क्वेश्चन प्रीति मैम से है, क्योंकि अब मेरी टीनेज लड़की डॉटर है, तो ये जो पीरियड्स का टाइम आता है, तो उनको भी एक हेल्दी लाइफस्टाइल होना बहुत जरूरी है। और क्या योगा उनको किस तरह से हेल्प कर सकता है कि उनका आजकल आप देख रहे हैं लाइफस्टाइल चेंज है, पोल्यूशन है, बॉडी का बहुत सारा इशू है, तो बच्चों को स्पेशली गर्ल्स हैं जो, उनको हम किस तरह से ट्रेन करें या किस तरह से एडवाइस करें कि वो आगे चल के एक हेल्दी लाइफस्टाइल स्पेशली पीरियड्स और इन सब के टाइम पे कर पाए।
बहुत वो आपने क्वेश्चन पूछा है, बहुत ही आम तौर पे पूछा जाने वाला क्वेश्चन है, और कोई भी इससे अछूता नहीं है, आई वुड से। तो हम लोग देखो, बाहर का एक्सपोजर तो हम उनको कम नहीं कर सकते, जो भी वो बाहर स्कूल में जाते हैं या फ्रेंड सर्कल ये सब होता है, परंतु हम अपने घर में जो माहौल है ना, वो तो हम सही रख सकते हैं कि टाइम पर सोना, प्रॉपर खाना पीना, घर का खाना, आजकल तो जैसे फिंगर टिप्स पे ऑर्डर हो जाता है, और जैसे ऑर्डर हो जाता है तो फूड बाहर से आ जाते हैं, है ना। तो वो भी एक, बच्चों को थोड़ा आदत कम लगाएं, खुद से खाना बनाना और खाना, थोड़ा थोड़ा ट्रेनिंग, जैसे हमारी माओ ने हमें सिखाया था, उसी प्रकार से थोड़ा थोड़ा हम भी उनमें ये आदत डालें कि अपना बनाया हुआ खाना इट्स अ प्लेजर, तो वो हम उनको सिखाएं। सो ऑल दिस वुड मैटर। और जैसे आयुर्वेद और योग में कहा है कि राजसिक आहार, सात्विक आहार और तामसिक आहार, तो जो मेंटली आप देखते हैं कि टीनेजर्स बच्चे आजकल काफी एग्रेशन होता है उनके माइंड में, तो जिस प्रकार जो इरिटेशन होता है, तो वो राजसिक आहार कम देवें, वो भी याद रखें। सो ये बातों को, मतलब जैसा आहार, निद्रा, ब्रह्मचर्य जो हम बात कर रहे थे, कि आहार निद्रा को तो आप कंट्रोल कर सकते हो, फिर सेंसेस को किस प्रकार यूज करना, जो स्क्रीन टाइम है उसमें वो लोग किन किन चीजों से एक्सपोज हो रहे हैं। और ये सब रीजंस की वजह से ना आजकल आप देखते हो कि लड़कियों को जो मेंस्ट्रुअल साइकिल शुरू होती है, वो जो एज कम होती जा रही है। तो मेरे पास तो ऐसी भी लड़कियां आई हैं जो 8 से 10 साल की उम्र में जिनको मेनार्की हो गया।
मेनार्की आजकल 10 साल पे ही हो रहा है, इट हैज इंक्रीज्ड।
सो मेनोपॉज भी फिर वो हिसाब से जल्दी होता है, तो उनका जो फर्टाइल एज का पीरियड था वो भी जल्दी होगा, लेकिन उल्टा हो रहा है कि करियर और पढ़ाई और बाकी सब जीवन के बाकी चीजों को महत्व देते हुए जो चाइल्ड बेयरिंग एज समझे बगैर उसको पोस्टपोन किया जा रहा है। जैसे डॉक्टर ने कहा कि 30 इयर्स तक तो कर लो, तो वो भी नहीं हो पाता है। तो बॉडी, तो हम जो आयुर्वेद में कहते हैं कि जो पोटेंशियल पीरियड है ना, तो एग्जाम्पल बट बढ़िया सा दिया है कि कोई भी फ्रूट है उसका एक सीजन होता है। जैसे एग्जाम्पल मैंगो है, तो वो आपको बेस्ट कब मिलता है, जो गर्मियों का सीजन है ना, मार्च से लेके जून तक या मई तक। सो दैट इज यू हैव टू सी कि उसका स्वाद, उसकी जो मिठास है, उसका जो रस है, वो बेस्ट उस समय रहता है। भले ही आप उसको फिर साल भर मिलता होगा, लेकिन उसके स्वाद में वो मजा नहीं होता जब वो उसका सीजन होता है। इसी प्रकार चाइल्ड बेयरिंग एज वो हमारे बॉडी का एक सीजन है, उसका फायदा उठाओ तो आप बढ़िया प्रोजेनी आपको मिलेगी, है ना, आगे आपका जो वंश है वो अच्छा मिलेगा। सो ये बातों को ध्यान में रखते हुए हम अपने जो आने वाला फ्यूचर जनरेशन है उनको भी हम यही धीरे धीरे हैबिट्स इनकलकेट कर सकते हैं। तो आपने जो प्रश्न पूछा वो तो काफी लंबा चौड़ा आंसर है उसका, बट यस, आपने जो प्रकार से अपने आप को सोचो कि बचपन में या टीन एज में आपको किस प्रकार की परवरिश दी गई, कोशिश करो कि उसको आप फॉलो करो अपने बच्चों के लिए भी।
थैंक यू मैम, थैंक यू सो मच।
बहुत सही कहा। जैसे कि आजकल हम लोग देख रहे हैं कि लड़कियां जल्दी मेंस से स्टार्ट हो जाता है, तो उस हिसाब से उनका खत्म भी जल्दी होगा। और जबकि पहले इतने करियर ओरिएंटेड नहीं थे, और अभी जब तक करियर नहीं है, जब तक गाड़ी बंगला सब नहीं है, तब तक शादी करने का सवाल ही नहीं उठता है। तो ये सब हम लोगों को ध्यान रख करके एक्चुअली वी शुड गो बैक टू आवर रूट्स। एवरीथिंग हियर सेज दैट वी शुड गो बैक टू आवर रूट्स। जितना आप अपने जड़ों से जुड़े रहेंगे, तो कहते हैं ना, पेड़ उतना मजबूत रहता है। तो अपने जड़ों से जुड़े रहिए, तो उस तरह से हम आगे बढ़ सकते हैं। Dr. Garima, there is one question for you. So here, this fellow is asking that.
Hello.
Geeta ji, we lost you.
Yeah, Geeta, we lost you.
Want to disclose? Yes, Dr. Garima.
No, I did not hear. I just lost you beach mein.
Oh, okay, sorry. So this gentleman is asking that which age sperm quality is good for male? You want
male usually male menopause doesn't really happen. It is not being heard of much, but yes, 40 years of age, the male sperm production also starts on is on a decline, though it can be improved with good diet and exercise and everything. But yes, post 40, 45 in fact, there is a decrease in the sperm amount and the quality. But the males can definitely go on for years. I mean, it's not the same way as a female egg, because female eggs are just the amount that they are at the birth, and male sperm production goes on happening all through their lives.
That's true.
Yeah, that's
yeah. So, and one more question for you. If a woman is physically active at her 40s, what about the quality of her eggs compared with sedentary women? As you said, the quality of eggs reduces. So by age, it reduces. Does the quality of eggs depends upon the women's lifestyle?
Now, you see, the quality of eggs would definitely reduce with age, because your eggs are getting older by the years. But yes, if you are physically very active female, the blood supply to the ovary would always be increased. With increased blood supply, the nutrition of the eggs would be better. So it would be definitely much better than that of a sedentary woman. You'll be surprised that I have patients from the Middle East, Arabic countries who come to us. And since they have diets, they have a good amount of estrogen naturally in them, because you must have seen they have rounded bodies. And
yes.
They have a naturally good supply of estrogen. Plus, their diet has a lot of olive in it. Olive, which is a great source of vitamin E. It is so surprising that you can see them having good eggs, good quality eggs, even in the mid-40s. So it is not that the quality just would fall down just because of the age. No, you have to take care of yourself. You have to be regularly exercising, having a very nice healthy diet rich in estrogen. Probably would go a long way with soya bean and tofu and milk and all the cheeses and proteins. It would go definitely a long way to keep your ovarian health and consequently egg health better.
Yeah, so it really depends upon the women's lifestyle habit.
Definitely.
Yeah. So they can in their daily routine, in their daily regimen, they can take the yoga, and there's exercises which are like to make their pelvic area healthier and all that. So it will really help. That is good. Thank you, doctor.
And one small tip here from Ayurveda to support this, what Garima said, is that Ayurveda also recommends about the Tarpan Kriya. Okay, so that is lubrication, and that is coming through ghee treatment in Ayurveda.
Yeah.
So
yeah.
of course, olives are not from our country, so Ayurveda recommends more about ghee, and they have very good herbal ghee preparations, which are supposed to be taken by these women. Even a pregnant woman can take it. There are different combinations and preparations of ghee. So I mean, ghee जिसको है ना herbs के साथ बनाया गया होता है, उबाला गया होता है, तो वो हर्ब्स का गुडनेस वो घी में आ जाता है.
मैं
That way they have different.
मैं इसमें आजकल there is a lot of emphasis on people eating देसी घी, and that is very correct, because क्या है कि आप हैरान होंगे ये जान के कि जो ये size 0 और ये जो बीच में सारा फंडा है, all the nuisance, because 70% of body fat should be there in women, at least, to have proper periods and proper conception. And all these ghee and desi ghee and natural ghees, they go a long way to help us be more fertile, and our egg quality is improving. Definitely. Thank you so much, Dr. Preeti.
हाँ, ये बहुत सही बात बोली कि घी तो हम लोग अपने इधर इतना खाते थे पहले, और अभी ये, और ऑल थैंक्स टू आवर सेलिब्रिटीज, तो ये 0 साइज के लिए आजकल लड़कियां बिल्कुल खाना ही नहीं चाहती हैं, तो दे शुड एक्चुअली पुट दिस इन देयर माइंड. So they are pouring the questions. I hope you don't mind, Dr. Garima.
So we can, I mean, we have to see Dr. Garima's time as well.
There are 2 more questions. What should I do?
Yeah, so these last two questions, okay? No more questions after this.
Okay. So the question is that if the mother is having gestational diabetes, any chance for the kid to get the diabetes?
Look, if the mother not the kid would not have the diabetes while being born. But yes, the mother, if she has gestational diabetes, there's a lot of chance that she gets diabetes later on in life, post her mid-40s. If she does not take care of her health, if she does not do the yoga properly, do the exercise properly, and gets fatter or doesn't care for herself, then she might go in for a diabetes later on in her life. And her kids, as far as her kid goes, after delivery, the kid wouldn't have diabetes. No ways, if he or she is properly delivered. But later on in life, as she or he is carrying the gene of the mother, they have to be taking care of themselves also. It's genetic, quite a lot of genetic as far as diabetes goes.
Yeah, so here, ma'am, you can also just tell this little light on this, that yoga also help in these cases. And
gestational diabetes is very much helped with yoga, and we have been successful in maintaining the sugar levels. So the insulin was avoided and they could just carry on with the pills. So, or maybe even the pills were avoided. Like I had myself one case where in one first pregnancy, this lady was doing the yoga with us, and she did not take any medication for her sugar maintenance. She was doing the yoga practices very regularly, of course, taking care of her diet as well. And the second pregnancy, she was in such a place where she could not reach us. And then she, in spite of knowing all that, she was just becoming lazy and she did not practice yoga. And she herself said that I had to take insulin the second pregnancy. Yeah. So yoga helps a lot.
Yes. So, Dr. Garima, is there any test required before planning pregnancy? Any test for men and women before planning pregnancy?
Before planning pregnancy, per se, you just require to see that your hemoglobin is good. You're good to go. You're good, blood supply. That is what hemoglobin is all about. And if there is any history of sugar or thyroid, blood sugar or thyroid in your family, you can get that tested also. Besides this, you definitely need to take folic acid. That I would want to emphasize here. Follow-wide, the day you start planning pregnancy, start taking folic acid, because that helps a lot in decreasing congenital anomalies in the babies. Rather than going for a barrage of tests, eat healthy, enjoy yourself, and be relaxed in mind, because everything starts from the head. You'll get a fine conception. Don't.
Very, very true. Very true. And folic acid is very important.
Very
important. And at this point, we stress in our pregnancy yoga training programs as well. And we stress on this to yoga teachers as well, that they should know, and whenever they are handling clients who are planning or also in the first trimester, they should make sure that the lady is taking folic acid.
Definitely. That's awesome.
Thank you.
Thank you, Dr. Garima, for giving so much of your time. And really a wonderful and informative session it was. Now, I would just like ma'am to request ma'am that if you can end up the session with our prayer.
Sure. So it was great. And on behalf of Pran Yoga Therapy Center and Pranava Yoga Vibes, we are thanking you really from the heart, Dr. Garima. It was great of you to share so many things and so much knowledge about this subject.
I learned a lot about yoga, all the more. I mean, I'm always a professor of yoga, but I today learned a lot more about what more can be done for the patients. Thank you too.
Yeah, so that's what is our motto, that all the pathies can go hand in hand and they can be working for the goodness of humanity. So it's during the COVID times, you must have seen that different this thing happened about different pathies, and one was trying to blame the other. So that should not happen, and all of them can go hand in hand, complementing each other.
Each other, definitely.
So with this, we just wind up with the closing prayers. Purnamadaha Purnamidam Purnat Purnamudachyate Purnasya Purnamadaya Purnameva Vashishyate. Om Shanti Shanti Shanti. Thank you very much, everyone, for joining, and be ready for tomorrow's session. Tomorrow's session is about postnatal care and COVID. So at 4 p.m. with the same meeting ID. So we will all see you tomorrow with Dr. Priyanka Shukla.
Thank you.
Thank you. Thank you, Dr. Garima Singh.
Thank you, Dr. Garima.
Thank you.
Thank you, everyone.
Thank you,
Thank
all
you,
the
Geeta ji.
participants.
Thank you,
ma'am.